given those disparities and given the fact that we have spent a lot more time walking towards each other with these two M's, Medicaid and Marketplace, there is so much crossover. What happens in the Medicaid segment for coverage also impacts and happens in the Marketplace business. So I think one of the things that we need to really be sensitive to is what happens to folks when they float in and out of the two forms of coverage. The messaging matters. And I think one of the things that needs to take place within the payer community, this is personal opinion after decades of experience, is to make sure, I've used this term before, I don't get the credit for inventing it, but meeting the member in their moment and being there for them. And so what that actually means is we need more in the Marketplace arena. We need more Medicaid-like behavior, meaning we should have in the payer world community outreach right there in communities. And some of the bigger plans have invested in this, where they are going into particular communities and finding someone in that community who can be an advocate for a force for good, essentially, that the messaging gets put out there. While they may represent a payer, their community responsibility is to say, oh, the payer that I represent isn't a good choice for you, and here's why. And I think we owe it to the population to try to get these inequities as equitable as possible so people know what their choices are. The healthcare literacy in some of the Marketplace business, and I'm sure it's the same in the Medicaid world, even the Medicare Advantage segment, is oftentimes low. So I put that on the back of the payer community. There's so much opportunity for us to do better to make sure that people know what their options are. And that float is always going to continue. By the way, when Kevin showed all those numbers and all that good information with predictive modeling, I think the industry can go a long way in helping over time, helping itself, whether it's government or payer or the platforms that are the technology drivers of all of this. We need to figure out ways to come together so that we all at the same time meet that member in the moment to make sure they're informed.
Absolutely. Kevin, anything on this?
I'll give the second yes and I'm really glad that Terry hasn't gone out and got a patent on that meet the member in the moment, because I use that one quite a bit since he taught me. So I'm really glad that I'm still able to use that one. But I completely agree. And there's a couple of comments that I have here. Number one is literacy in healthcare is very challenging. And I've been in the industry for several years now, and healthcare is still confusing to me as well as many others. So how do you engage other distribution channels like the broker community and have them better support these cohorts of individuals to navigate their healthcare and support, because they are an extension and they are experts in the space. So how do you engage with the brokers to make sure that those members are continuing to maintain their coverage? And as far as addressing health equity, I do have an example as we talk about meeting the member in the moment, where we actually work with a payer that has integrated their payment solution with retail outlets. So if you use this example, you're sending a monthly premium invoice to the individual. That individual can walk into a retail store, a drugstore, as an example, when they're picking up their prescriptions. They can go up to the counter, and perhaps they're an unbanked member, and they make a cash payment for their monthly premium by handing the invoice, they scan it in, and they make their monthly premium payment, whereby that payment is then processed to the health plan. That member retains their coverage. So that's just an example of when you think about ways that you can further engage with the population and you could give them a multitude of opportunities to be able to hold on to their coverage and move that care forward, that is certainly an option that we think is probably going to pick up a lot more speed as we go forward here.
So I want to just add one more on top of that, if you don't mind, Kristen, that is a great example of how the industry can be much more retail-like. I know it's complicated. I know there's lots of systems, lots of laws, lots of complexity, but packaged goods organizations, banks, there are a number of examples in other industries that are well ahead of where we are in healthcare, and we should be connecting and modeling those things. So that crossover right there, you know, Kevin used the good term, the right term, the appropriate term. Many of these folks just don't even have a bank account. Many don't have a computer. And so the easier we can make it for them to meet whatever the challenges of life are, so that they stay covered, I think it's a responsibility that we all have.
I'll give one more example if I can, Kristen, as it relates to, you know, life happens, right? And especially through COVID, there's different challenges that occur that maybe you can't make that payment this month because of whatever had come up. You're out of work for a couple of weeks because you have to quarantine. And so another option here is setting up payment plans for these individuals. Folks may not be able to pay this month. So do you have an opportunity to, as opposed to terminating their coverage and having them call and beg to be reinstated, how do you work with those individuals to set up a payment plan so that at the end of the day, you're still getting your premium payment, but this member is able to sustain that coverage and still be able to live their life without having this burden of being able to afford their health insurance premium that month. So setting up payment plans is just another example of how you can, you know, better engage with these folks and give them the best opportunity to stay enrolled and keep that coverage.